Let you guys be there together. Okay, it's just after 7 o'clock. I'm going to call the meeting to order. Yay. First order of business is the minutes from last week.
Madam Chairperson. Did you like that?
I did, I liked that. That was...
It was better than Tanya, right?
Okay.
I just would like to make an addition, just a clarification. It's on the second page at the bottom. It says, Mr. Scanlon questioned if there'd been an increase since the Head Start program at the Pines had been canceled. Ms. Algren explained that they had applied for a grant that would be used for outreach at daycares, etc. Community outreach was discussed. I'd like to add, in the case of outreach to the Head Start at the Pines, the library funded these programs from their own budget.
Thank you.
Did you catch all of that, China? Okay.
I've got it written down if you want. You want to see it?
Is there any objection to adding that to
No, no.
I didn't think
We were
okay.
talking about the budget for the library anyway.
Exactly.
Yeah.
I'll make a motion that we approve the minutes with the added wording to the paragraph, so that last paragraph on the second page.
I'll second that. Do we have any discussion? Hearing none, I'll call the vote. All those in favor, please say aye.
Aye.
Anyone opposed? So moved.
Maybe I should have asked this before. Are we going to hear back from the library on the heat? There's such a discrepancy.
No, it wasn't. We already voted on that.
Okay, all right.
Yeah.
Okay. Alrighty. The next order of business is the Franklin Visiting Nurses Association. Before we actually get into that, there was something I lost it. It's one of those moments. Are you here from the visiting nurse? Nice to meet you. Can we have you come and sit up here? Hi, Carol. I'm Tony Belair. I'm the chairman.
I've been there before.
I probably.
Hi, Carol, I'm Scott Davis.
And Bob Zott.
This is John Scanlon.
Hey.
Jane Alden.
Catherine Dawson.
Okay. You're asking for level funding
Yes,
from last year.
correct.
On there. Can you just, for the record, just give us a little synopsis, an overview of what
I'd love to do that.
That would
Great.
be great. You want to start there?
Okay, we're Franklin Visiting Nurse Association and Hospice, and we've been serving the community of Tilton and area communities for 66 years, providing home care services. We, 5 years ago, became certified to provide Medicare-certified hospice care for end-of-life care, and so that's been a welcome program for the community, and certainly has been a good adjunct for our agency. In this past year, well, it's the year 2010, you know. It's kind of funny because we're at the end of 11, but in 2010, we served 100 patients in Tilton, and I gave you some statistics there as to just the sorts of visits that were made, and broke the hospice visits out from the regular home care visits. We have, you know, like any healthcare agency, we're going through the pains of regulatory constraint and budget cuts and national changes to Medicare and so forth. And in this past year, we experienced a reduction of about $75,000 worth of funding from the United Way and from Merrimack County. Decided they weren't going to do any grants, which helped to fund some of our homemaker program. And so we really felt that hit this year in a very substantial way. Also, there have been a lot of changes in how patients are cared for, as in total hip replacements now don't take the recovery time they took, and so that cuts down the number of visits the patients need. Good for them. It's a wonderful thing, but it has reduced some of our revenue stream as a result. And all home care agencies are going through this, and it's just a matter of constantly looking at what you do and how you do it and how you do it better.
How is your staffing?
Better than if you asked me 2 months ago. We've had some turnover this year, and hindsight being what it is, it's been really good for us that we did have that, but we have a new clinical manager who's just great, and 3 new nurses, and we had to bring a new occupational therapist on board, which is no small thing because therapies are few and far between in terms of getting the ability to hire therapists. We compete with hospitals and some of the freestanding facilities that are more flush and able to pay a greater amount of money. But we're really lucky that we have the staff we have.
Wonderful agency.
Do all of your services require a physician's? Everything that you provide has to come
Well,
through a prescription?
no.
Basically,
Not homemaking services. Our homemaking services are funded under a grant from the BEAS, and they don't require a doctor's note. However, we do communicate with the physicians of those patients to kind of keep them in the loop. Everything else requires a doctor's order, yeah.
and it's normally limited time that you're there with the patient for
Right, yeah.
or as long as they're needed.
Intermittent visits to return them to independence to whatever degree that can be done.
Have you noticed a difference in the need for your services?
There is, I've noticed a big difference in the ability of people to afford it, because of loss of employment, and people's insurances then are defunct, and so we're doing a lot of fee scaling for them so that they can have the services that they need and still have some reasonable amount of money to be responsible for. But even at that, often, we don't ever see that money, because you can only get so much out of when people don't have it. So we have had losses in terms, offered free care, and that's some of what the monies that we get from the town of Tilton help to offset some of that shortfall.
But the need is still there. You're still seeing the same number or more or less people.
I think we saw more patients this year than we did the year before. We have expanded our hospice program to the Veterans Home, St. Francis, Golden Ridge, Peabody Home, so we are more available for people to choose us.
For all of the various.
I notice you have the number of services that you provide in Tilton you think are going to increase next year. What did you base that on?
Marketing and outreach into the community, and trying to make people more aware of us. Sometimes because our name is Franklin VNA and Hospice, people don't always recognize that as an available service to them. And we have a liaison nurse who goes up to the hospitals to The discharge planners give patients a choice. She's there to help them to know what we can do.
And I believe she also came and addressed our chat committee
Yeah.
recently.
Wanda, yes.
She was very good. It
Yes,
was-
she enjoyed that very
Yeah.
much and was saying that there are opportunities to work together more.
Does anybody else have any questions? I didn't see anything that stood out for me on the financials when I was reviewing them.
You base the billing, from lack of a better word, on the population? On the population?
Yes. What we
adult
asked from the
people, or-
town. On the town's population, yeah.
Of elderly or of people who might?
No, total town count. Total town census. That was available, the census that was available to us in 2009.
3,578 people, that's all we have in town?
Yeah.
Really? Wow. Okay. I just thought it was more than that.
You thought we were bigger?
I thought we were 4,000, I don't know why.
We're about 3,600.
Okay. Oh, we're gaining then. You can charge us.
We haven't gained as they thought the chart was going to gain, though.
We haven't.
No,
I think if they did it by the age, you would be probably asking for more, because I believe that our population is 65%, considered 65% elderly, so.
It's true for the state of New Hampshire. You know,
Yeah.
the elderly population is growing by leaps. That is another that kind of goes to need for services, because so many people in my age and up are moving to this beautiful place to live, which is what I did 20 years ago.
No, you have a great agency, Carol. You should be proud of what the service that you provide to the communities.
And I commend you for fee scaling. I think that's very important in this economic time, despite the fact that you're not getting the money you expected.
Well, that's part of why we ask for town help, and we do fundraising and those kinds of things to try to help to offset that. There was a time when Medicare's reimbursement was sufficient to offset all of the shortfall of Medicaid and so forth. But since Medicare's, over the last 5 years, we've experienced a 23.7 or something % cut in our Medicare rates. It's really dramatic, and we're facing more cuts in January. So we're just well, I'm not. They're getting skinnier and skinnier, the staff. It's just a challenge to meet the needs, but we can go on. We've appreciated the support that Tilton has given us very much.
Well, we appreciate you being there. There's a lot of people that need your service, and that, we're happy that you're there for them.
Thank you. We're happy to be there, too. We do need a representative on our board from Tilton, so if you have any thoughts, the thing is that everybody's so busy. I know that. It's not a big demand of time, but we sure do want representation
From a chat committee, maybe?
from someone who really, it would be good if it was somebody that knew about how nonprofits operate, because, it's a different kind of business model than for-profits are. But if you think of someone and they have some interest, you can give me a call. I'd like that very much.
Okay? Thank you very much.
Thanks,
Thank
Carol.
you. Thank you all.
Thank you, Carol. You have a good evening.
Thank you. Beautiful evening.
Yes, it is gorgeous out. We'll take another 60 days straight of this.
Can only hope.
Yeah.
Could take it all winter.
Good night now.
And that's why.
Child and Family Services. Okay, next on the agenda is Child and Family Services. Oh, Are we early?
Yeah, we're a little early.
We're about we're about 15 minutes early. Would you prefer to wait?
You asked in your letter to have somebody to explain finance, and I'm the program person, he's the finance, so he was going to join me in case you had any questions about budget. But I'm happy to wait and let other people go first.
Well, actually, you two are the only on the budget, but
Why don't we keep our questions to programming? That's here.
We'll put you on the hot seat, how's that?
I hope he's not sitting down at the fire district's budget committee meeting.
Oh, I hope not.
it won't get them very far.
So I'm Ruth Sachs from Child and Family Services,
Well,
and we're asking for level funding again this year. Our office in the Lakes region is in Laconia, and we serve the entire region. We provide a range of services to families, counseling with kids, youth, parents, trying to strengthen families, keep them together. I think along with our materials, I sent you some of the services that we offer in the Tilton area. And in looking at last year to this year, the number of families that we serve doubled in Tilton.
From 2010 to 2011?
So there are more people coming to us. The amount of free reduced services that we provided last year was $33,000 worth. Of that, about 35% was charitable money. Some of it came from the town of Tilton and from public sources. We had a reduction, well, I am talking about money, aren't I? We had a reduction from some of our state-funded programs in July of 2010 of 2%, and then in July of 2011, some things were really obliterated. And we found ourselves in an interesting position of shrinking in some areas and growing in others. Some programs, they were referring to twice as many families to us as I'm talking about the state, and paying for some services, like our parent aid service, which works with families who have founded abuse and neglect cases. We're getting far more referrals in that program, so the state was coming in and removing more children rather than providing prevention services. They were taking away the funding for prevention services and waiting until there was a crisis, removing the child, and paying for our parent aid service, which provides supervised visitation, modeling of good parenting, according to the court, so that the child can go back home. So we're finding some of that is happening, and at the same time, the state services that prevent placement and prevent the removal of children are not getting the referrals. For instance, our Parenting Plus program, which is a voluntary program. Hi, Tony. Tony.
Hey, Tony.
I know, they started early, and they promised they wouldn't ask me finance
Nothing
questions.
financial.
And she jumped right into it.
And I did. So I was just explaining some of what's been happening budgetarily and programmatically, how some programs are shrinking and others are growing beyond budget expectations. So
I did notice that there were, in some cases your revenue was up. The expenses were up there as well, but they still weren't matching. You're still don't have enough revenue in to cover your expenses.
On the Lakes Region budgets, yeah, you're in particular the Lakes Region budget.
Yeah. I was last night or something like that. When I wrote these questions, and it doesn't necessarily...
And that's why we're here looking for funds. In part, we need to raise additional funds. I think it was about $20,000.
it looked like that you weren't budgeting enough revenue to cover the expenses, but it didn't look, did you have any expectations of having to cut programs in order to not overspend if you don't get your?
Well, the budget you were presented is a component of our overall agency budget, which is balanced. But when you extract just the Lakes Region programs, there is that deficit. So we're obviously always looking for ways to either increase revenues or reduce expenses if we need to, but that's the overall agency budget. Well, on a budget basis, it's balanced, then of course things change during the year, so.
We are a statewide agency, and for the Lakes Region, for the towns in the Lakes Region, we prepare a regional budget, so you can see what's being raised and spent here. But some of the programs that we offer in the Lakes Region, we also offer in the Concord area and the Manchester area, and so the budget figure is larger.
What are those towns that you consider the Lakes Region?
I'm glad you asked.
That can be small.
Alton, Barnstead, Belmont, Bristol, Center Barnstead, Center Harbor, Guilford, Gilmanton, Laconia, Lisbon, Meredith, New Hampton, Northfield, Sandringham, and Tilton.
Lisbon?
How did Lisbon get thrown into that?
Yeah, it's part of
So
the
random.
Well,
That is so random.
I'm not quite sure.
And
Lisbon's-
Franklin's not there.
Franklin is in Merrimack County.
Okay,
I
okay.
would even think Lisbon would be in
Lisbon.
So this is in,
Grafton
Grafton
yeah.
County.
But we serve all
See,
the
they
way
got
up,
Bristol, though.
and we don't,
Kind of focused on Bristol.
yep,
But Lisbon's
I know.
up Franconia, that's beyond the notch. How do you get that in here? In the Lakes region?
well, we also,
On Route 10, isn't it?
Yeah, it's
and
up
it's
way.
probably because I don't do any Grafton County towns other than Lisbon, because we provide services there,
Yeah.
so.
So you extrapolate those communities out of your budget,
Out
those
of our overall
expenses,
budget.
your overall,
Present these to you, yeah.
and it shows a loss.
Right.
And I think what we're using is the United Way towns, and Lisbon is considered part of that, the Lakes Region United Way.
I don't remember there being a big lake up there, but
River?
there's a river. I don't remember there. That flows. I mean, Echo profile, but Lisbon isn't near Echo profile. All right. The rest of them are good. They matched them.
Well, I'll just check on the Lisbon one, but that they have supported us for many years, and they always came in under the Lakes Region towns. And I guess it's because they were served by our Lakes Region office.
Probably the closest.
The closest
Laconia, our
counseling office.
Is in Laconia.
Yeah, nothing, there's nothing up in.
We have a Plymouth office, so Laconia is probably the closest.
We have a Littleton office, but we don't provide counseling services. Most of the money that we ask the towns for helps to provide counseling to families who are uninsured, underinsured, just, can't pay co-pays to couldn't afford mental health clinics. We're kind of the last resort for them to get mental health services. Mental health actually within the new rules, because they don't have chronic and persistent mental health problems, don't need medication, wouldn't be served by a mental health center anyway. So they would come to a family counseling program, but they don't have the funding to pay for it. So that's what we look for the charitable money to help them.
Well, you're not asking for a ton of money. The town of Tilton, $2,500 is, I mean, every penny at this point matters.
That's what we try to do, is get a little bit from a lot of places, and it all adds up to something.
And what's been wonderful is even in these very tough times, all of the towns that we have approached in the Lakes region have continued to fund us. So,
We have heard, good things through our people here in town, saying that your services have expanded within the town and that you've been very, very easy to work with.
oh, that's a good thing to know. That is good to know.
What does your program service fee include?
What does our program service
Yes.
include? It's different for each service, so,
But what are those services that,
well, in,
are they all of your services that you offer?
yeah, all the services that we offer in the Lakes region, so,
All right, that's,
for instance, adolescent substance abuse treatment, everything has a unit cost.
okay.
Based on the kind of staffing you have to
Okay.
provide, how much travel we do. A lot of our services, we go out and do home visiting. We don't necessarily have people come to our office. We go out and visit them in their homes, or we'll go into community settings or schools. So a lot of, you'll see in our budget, there's a lot built in for travel. We're on the road.
If you have to drive up to Lisbon, yeah.
Yeah, we did over 1 million miles last year.
Really?
Okay.
Over 1 million miles, and Tony has the budget to prove it. But there are so many people who are unable to get to our office, who don't have transportation, can't leave an ill child or an ill family member at home, or they're afraid of an office. So we go to the home.
I remember you saying something about going in to do, like with, there was something about somebody who needed not child care, but instructions on how to
Parenting, yeah, well,
parentate that.
Just knowing how to set a schedule, so you put your child down for a nap at the right time, that you give them nutritious food, that
Right,
you
and that
set
was-
routines. And a lot of the folks that we deal with day to day were poorly parented and don't have a clue. And so we go in, we model good parenting, positive discipline, how to correct a child without yelling and screaming or hitting. We do parenting courses in the home, we do small groups in community settings. So our goal is to build on the basic skills and strengthen families, and to avoid child abuse and neglect petitions.
How do you obtain your clients? Is everybody a referral to you from one source or another?
Schools, I was with a group of school nurses today in Plymouth, yeah, also not in the Lakes region. But we were talking about healthy kids and that insurance program, and how much more difficult it is now with all the budget cuts for them to get kids linked up to that program. And we were talking about how we might help with that through our network of services. But we get referrals from school nurses, from doctors, from guidance counselors, from pediatricians, from DCYF, from juvenile probation workers, from neighbors. And people self-refer. People will call us and say, we have I don't usually list it as one of our services, but we have an 800 number. It's called Parent Line, and it's a 24-hour, 7-day-a-week call-in service that parents can get basic parenting advice and get linked up with an expert. And it's not a crisis line, so I'm about to kill my kid is not
No,
the
call
kind of call
911.
we get. Yeah, that's not the kind of call we get, but it's I'm having trouble with toilet training, I'm having trouble, my kid wants to go to the mall, and she's too young, my kid's out of control, she yells at me all the time, she won't get up to go to school, all of those kinds of things. And so we'll do parenting advice, and often what will happen is that parent and that child will then come in and go to one of our groups and learn how to communicate better with each other. So it's kind of an entry point that's non-threatening to a parent. It's kind of a warm line.
What are children's enrichment activities?
Well, that's interesting. That's funded with charitable money, and it's the Annette Schmidt Fund. Annette Schmidt,
Yeah, that was on my...
Annette Schmidt was a fairly wealthy woman in the Lakes region area, and when she died, she left her estate to charity, and she specifically wanted a piece of her trust set up so that poor children, children who didn't have advantages, could benefit from this fund. And so the way in which it was set up, a school teacher or a coach or a parent can apply to us. We manage the fund for up to $200 once for a child to buy hockey equipment or a week at summer camp or dancing lessons, something that's going to enrich the child's life. And we'll pay up to $200, so it'll be a membership to the Boys and Girls Club. It's, if a family has no other resources, that fund is put into play. We served over 400 kids in the Lakes region last year with that fund.
Do you ever work with any of the, recreational departments or anything like that to try and get some of the kids involved in programs, or how does it?
I'm sure some of our staff do, especially when you'll see the Adolescent Substance Abuse Treatment Program. That was funded with a 5-year grant, and it ended this last year. And we've been able to raise some charitable money to keep a staff person on part-time. I think it's 1 day a week to see some referrals of adolescents who have substance use problems and to do some treatment. Part of that program was to help kids find positive activities that didn't involve drugs. And so that person, that counselor would reach out to recreation folks and get kids engaged in organized sports or the skateboard or the roller rink. Is there a roller rink in town? Only I think it was.
There's a new roller rink here.
Or, some kind of activity that was positive and empowering that would, get them thinking that there are other ways to get high other than doing drugs. And they worked with a lot of the rec folks and through the schools as well. But I don't know the exact answer to that, but I know in that particular program we did that. And then the summer camp program that we run, Camp Spalding, which is all charitable money. We had
You have 5 people?
5 kids. 5 kids. From,
do they have to pay for that, or?
well, it costs about $960. You were asking for fees. About $960 for 2 weeks of summer camp. Families pay based on their ability to pay. It's a sliding fee scale. The average family pays $75 toward that 2 weeks of camp, and the rest we raise charitably. So,
Can you explain under family counseling, say, social and mental health issues? What are social and mental health issues? Well, the mental health issues is...
A child has suffered some type of a trauma. Maybe they've witnessed violence, one parent against another, and have become traumatized by it. It's affected their schoolwork. It's affected their eating habits. It's affected their peer relationships. We'll work with the child to talk about what they experienced, how they might, to work through it. It's behavioral therapy. A child might have a parent chronically ill or terminally ill or incarcerated, or lives in a family where there's substance abuse, and is angry and acting out in school, and it's affecting schoolwork and peer relationships. We'll work with that child to help them manage their anger.
You keep saying child, not the adults?
But we work with the family.
Family.
Yeah, so we'll do counseling with the child, we'll do counseling with the family. So we work with the entire family, we work with schools. I think that's what makes us different from the mental health system. We look at the family as a whole system. What we're trying to do is help families be better parents by giving them skills to raise their children.
So it's not done through psychiatrists and that sort of thing? It's done through counseling?
Therapeutic counseling.
Okay.
And what if you have one of the parents that has the mental health issue? Do you work with them?
We do.
And if they need,
If they need medication, if they're, then we will refer to the mental health center.
Which center would you refer to?
Usually the Lakes Region Mental Health Center in this region, Genesis.
Can I ask you one question? Do we have I was looking at your investment, and you're hoping it'll go up considerably this year? Yeah, investment income. You obviously didn't see the market today. Oh, it's almost 400 points, yeah. Yeah, you better hold off retiring a little bit longer.
I know.
It's actually,
Yeah, then I can retire. Think
the
about it.
budget's down from 15,000 to 14,250, 2011 to 2012.
Right, I noticed that,
But your actual
Your
is
actual is
1348.
1,300.
Well, that,
Is there money coming in the last quarter, possibly, that isn't in there yet?
there's the detail on that, because I think that's not all just market-based. I think that might be, there's some of that Schmidt money shows.
Schmidt money is also included in that, because that's about 8,000. Schmidt money is included in that, because that's about 8,000. Probably just hasn't been plugged in yet, then. It just jumped out at me from...
Yeah, that's not investment income as you would think of as earnings.
Okay, all right.
It's related to the net Schmidt and also to we on occasion put on a conference and we get some,
Oh, that's right.
we didn't do it this year.
No, haven't done, yeah, we,
The $10,000 budget is for a conference that is it every 2 years now?
well, we've been doing it every year, but we couldn't find a speaker in the time that we want to do it. We do an educational symposium and a parent evening in the Lakes region. We've been doing it for 8 or 9 years, and about 250 professionals come and 100 parents come, and we bring in a national speaker, and we make it affordable for the professionals and free for the parents, and we provide childcare. And it's we had planned to do one in 2011, but it just didn't come together.
Thank you.
on your application, it says that some of your funding comes from the state of New Hampshire contracted services.
Right, that's the parent aid.
Iffy these days, or some of those contracted services?
Yeah, that's what I alluded to. That's what I alluded to when I first started, is in 2010, on July 1st, 2010, we had a 2% across-the-board cut in all of our contracted services. And then in 2011, on July 1, there was big chunks of money cut out of the budgets.
Instead of cutting rates, they restricted eligibility.
Right.
Interesting.
Yeah.
And it says in here that you work with fathers, and it sounds like they are inmate fathers?
Yes.
Is that through the prison system?
Yes.
Is that contracted through the state?
No,
That was federal.
that was a federal grant, yeah. And we've also been working at the women's prison and using some of our contracted money, our Parenting Plus money, at the women's prison and at the Shea Farm halfway house. And have just gotten one charitable grant to continue that work.
And that was my question, does that responsible fatherhood also include motherhood?
But yes, yes, we're doing responsible motherhood and helping, sounds weird, but helping moms who are incarcerated remain connected to their kids.
Just the same.
Yeah, and then we're also, once they leave Shea Farm and go back home into their communities, our goal is to link them up with a Parenting Plus counselor and reduce recidivism. Because one of the things we found with women, and men as well, is that without that kind of support, it's very easy to go right back to bad habits, go back to substance use, go back to prostitution, and do stuff that gets you parole violations and you're right back in prison. And women have a very high recidivism rate. So they're trying to keep women, men and women, connected to their spouses and to their kids while they're incarcerated. And it's had some great outcomes, especially the men's project.
Oh, sure.
Thank you.
Any questions?
Good luck on the investment.
So it went down again, huh?
It's going to hit tomorrow hard, too.
In the third quarter, it was awful, of course, then it came back.
Came back.
October.
I'm going to try
I'd
to
like
keep
to see
the
that much
conversation here.
rationality in markets.
So up and down.
We have a question, this Board of Selectmen is here with us, behind us, and Joe Justman has a question.
Yeah, I don't know much about the Child and Family Services Division. I'm the new guy. And I have a question concerning pregnancy counseling and adoption. It says unbiased counseling for parents facing unplanned pregnancy. I have to assume that would include talking about abortions.
We talk about all the legal options that women have. We don't push them in any direction.
I guess what I really want to know is any of your money going toward providing abortions?
No, none.
Any other questions? Any questions from them? Okay. Great, thank you very much for coming in.
Thank you.
Shouldn't
Have a
be
good
too
evening.
painful.
Good to see you again.
Thank you.
Put myself back together.
You ready to entertain motions?
I am ready to,
I'd like to make a motion that we fund Franklin visiting nurses at the
6:30.
$15,630.
I'll second that. Okay, go ahead. Lynn, go ahead.
I second.
I'll sit back.
we have a motion and a second to fund the Franklin Visiting Nurse Association level funding for $15,630. Is there any discussion?
I just think they're a good agency. I think they provide an invaluable service for people that need that. There's no question.
The amount of service you get for those dollars is...
And the hospital, for a lot of these people, the hospital won't keep them now, so they send them home in a state that, if they didn't have these people, I don't know what they would do,
Yep.
unfortunately.
All right, hearing no other questions or comments, I'm going to call the vote. All those in favor, please say aye. Aye. Anyone opposed? So moved.
I'll make the motion that we fund, let's see, is it level fund Child and Family Services at $2,500?
A second?
We have a motion and a second to fund Child and Family Services at $2,500. Is there any discussion? Hearing none, I'll call the vote. All those in favor, please say aye.
Aye.
Anyone opposed? So moved. Next item on the agenda, discussion other business. There are a couple of items I want to just, the start of the meeting, we received this 10-year road construction plan courtesy of Dennis Allen through Sandy, which, you weren't here, I don't know. Do you have another copy? Copy. So people want to review that, take a look at it. I was thinking that next week, where we have the financials, normally this would be our only monthly meeting, and we would review financials, get them tonight and review them tonight. But I was thinking that we could have some time. We only have the rec center in front of us next week, that we could take a chance over this next week to review the financials and then talk about them in depth next week, give us a chance to really look at them. And will give us a chance, too, we can take a look at this 10-year highway plan and see if there's anything we need to, any questions, comments on that next week. Okay. One bit of unfinished business from last week. At the end of the meeting, I had commented that we had gotten that letter from Genesis and that I didn't want to make any questions or comments until I'd had a chance to really review the letter. I have reviewed the letter from Director Pritchard, and I don't see any reason to revise our vote or schedule a time to meet with the representatives from Genesis. Does anyone here feel differently? Okay, then the decision will stand, and we will not schedule a meeting.
Are we going to respond to their letter?
Well, yeah.
It asks for a response, that's the only reason I'm asking.
I hadn't anticipated making a response.
If we're in a discussion phase, I think we should. I mean, I hate to go back and forth all day long sending letters, but just saying no. We said no for one time, and it's going to stand.
Okay?
So you're suggesting not to?
I suggest we drop the letter to them, just explaining them,
And just tell them that they're open to apply next year, and this year that we just can't.
Money's just tight, and we're just not going to release it.
So I missed that. Second
Money is
response
just
or
tight.
response?
Yes, I feel the board should respond.
A second time?
Yes, we got to let it, well,
I will write them another short letter.
yeah, nothing fancy, but pretty much reiterating what we said the first time.
I think I can do that. The letter was it was very short to start with. I think I can say it again.
Perfect.
Didn't miss anybody,
Yeah, change the
There you
date,
go.
Tony. I think that's a good idea. Just change the date.
White out.
I'll just tell them that we were in receipt of their letters, and there's, when we discussed it, and there's been no change in our thoughts, and we will not be inviting them to come before us. Okay? And I'll bring that next week. Okay, that takes care of everything I had. Does anybody have any other business that they wanted to address?
Make a motion, we adjourn at 10 minutes of 8.
I second that.
Okay, we have a motion and a second to adjourn in 60, 59, 58.
Take note of this. Less than an hour.
Okay, all those in favor, please say aye. Aye. Anyone opposed? So moved.
Wow.
Okay, next week.
Didn't even get more.